Hello everyone, welcome back to Public Health Series. I'm Dr.Sadaf Nayab, and in this video I will be briefly walking you through the national health programs in India. The national health programs are broadly categorized into four sections, namely reproductive, maternal, neonatal, child and adolescent health, national nutritional programs, programs for communicable diseases and non-communicable diseases. Now, let's talk about the various programs under the first category. First program is called Janani Shishu Suraksha Karyakram or JSSK, which was launched on 1st June 2011 to eliminate out-of-pocket expenses for institutional delivery of pregnant women and treatment of sick infants. It stipulates out all expenses related to delivery in a public institution would be borne entirely by the government and no user charges should be levied. So there are some amenities given to pregnant women and also for sick newborn till 30 days after birth. The amenities for pregnant women include free and cashless delivery, C-sections, drug and consumables, diagnostics, free diet during stays in health institutions for 3 days in case of normal delivery and 7 days in case of cesarean sections, free provision of blood, exemption from user charges, free transport facilities and free drop bags from institution to home after 48 hours stay, and there are similar amenities provided to new sickborns. The next program is called Rashtriya Kishore Swasthya Karyakram, which was made to ensure holistic development of adolescent population, and it was given by Ministry of Health and Family Welfare on 7 January 2014. The objectives are as follows: develop proper reproductive and sexual health, improve the mental health of adolescents, prevent violence and injuries among adolescents, improve nutrition, prevent substance abuse, promote healthy lifestyle among young people. It focuses on 6 C's, which are coverage, content, communities, clinics, counseling, communication, and convergence. The next program is called Rashtriya Bal Swasthya Karyakram or RBSK, which was launched in 2013 under National Rural Health Mission. RBSK is a program to improve the overall quality of life of children and provide comprehensive care to all the children in the community. It focuses on 4 Ds, which are defect at birth, diseases, deficiency and development delays, spanning 32 common health conditions for early detection and free treatment and management. There is an implementation mechanism for RBSK, which is divided into newborn children for 6 weeks to 6 years, for children of 6 years to 18 years, and for newborn they have facility-based newborn screening at public health facilities, and there are community-based newborn screenings done. For children of 6 weeks to 6 years, there are Anganwadi center-based screening by dedicated mobile health team, and for children 6 years to 18 years, there are government and government-aided school-based screening by dedicated mobile health teams. The next program is called Universal Immunization Program. The immunization program in India was introduced in 1978 as the Expanded Program of Immunization or EPI. In 1985, it was expanded as Universal Immunization Program or UIP. It is one of the most cost-effective public health intervention and largely responsible for reduction of vaccine preventable under 5 mortality rate. It is one of the largest immunization program in the world and a major public health intervention. Under UIP, immunization is providing free of cost against 12 vaccine preventable diseases. Nationally against 9 diseases, which are diphtheria, pertussis, tetanus, polio, measles, rubella, severe form of childhood tuberculosis, hepatitis B and meningitis, and pneumonia caused by Haemophilus influenza type B, and subnationally against 3 diseases, namely rotavirus diarrhea, pneumococcal pneumonia, and Japanese encephalitis. The next program is Mission Indradhanush, which was launched by Union Health Minister J.P. Nadda on 25th December 2014. Its goal is 90% full immunization coverage of India and sustain the same by year 2020. Under this drive, focus is given on pockets of low immunization coverage and hard to reach areas where the proportion of unvaccinated and partially vaccinated children is highest. Intensified Mission Indradhanush. To further intensify the immunization program, PM Narendra Modi ji launched the Intensified Mission Indradhanush on 8 October 2017, and through this, the government aims to reach each child up to 2 years of age and all those pregnant women who have been left undercovered under the Routine Immunization Program or UIP. Intensified Mission Indradhanush 2.0 was made to boost the routine immunization coverage in the country. The Minister of Health and Family Welfare, Dr. Harshvardhan, introduced Intensified Mission Indradhanush 2.0 to ensure reaching the unreached with all available vaccines and accelerate the coverage of children and pregnant women in the identified districts and blocks. The next program we'll be covering is Janani Suraksha Yojana or JSY. So it is a safe motherhood intervention under the National Health Mission. It was launched on 12th April 2005 by the Honorable Prime Minister with a special focus on low performing states. It is being implemented with the objective of reducing maternal and neonatal mortality by promoting institutional delivery among poor pregnant women. Here is a table on the scale of cash assistance for institutional delivery given to low performing states and high performing states, and it is given to mothers as well as ASHA. Please refer to your table for more information. So the next program we'll be covering is Pradhan Mantri Surakshit Matritva Abhiyan, which was launched to provide fixed day assured, comprehensive and quality antenatal care universally to all pregnant women in second and third trimester on 9th of every month. It aims to ensure that assured and comprehensive antenatal services are provided to pregnant women and designated health facilities by obstetrician and medical officers. The program also invites active participation from private practitioners on a voluntary basis. On 31st July 2016 episode of Man Ki Baat, Honorable Prime Minister of India has appealed to doctors across India to contribute 12 days in a year to this initiative. Next program we'll be covering is Navjat Sishu Suraksha Karyakram, which is NSSK, which was launched for the protection of newborn. NSSK is a program aimed to train health professionals and personnel in basic newborn care and resuscitation and has been launched to address care at birth issues, that is, prevention of hypothermia, prevention of infection, early initiation of breastfeeding, and basic newborn resuscitation. Newborn care and resuscitation are an important starting point for any neonatal program and is required to ensure the best possible start in life. The objective of this new initiative is to have a trained health personnel in basic newborn care and resuscitation at every delivery point. The last program in this we'll be covering is the National Program for Family Planning, which was done in 1952. Over the years, the program has been expanded to reach every nook and corner of the country. So there are various initiatives taken under the National Family Planning Program, and I'll be talking about some of them. First is the new contraceptive choices. The current contraceptive basket comprising of condoms, combined oral contraceptive pills, emergency pills, intrauterine contraceptive uterine device IUCD, and sterilization has been expanded with inclusion of two new contraceptives, which are injectable contraceptives under the Antara program and Centromin under the Chaya program. Next is postpartum intrauterine contraceptive device. It is an incentive scheme under which PPIUCD services are provided post-delivery. Compensation scheme for sterilization acceptor, which provides compensation for loss of wages to the beneficiary and to the service provider and team for conducting sterilization. National Family Planning Indemnity Scheme, under which clients are compensated in the eventualities of death, complication, and failure following sterilization operations. Family Planning Logistic Management Information System is a dedicated software launched to ensure smooth forecasting, procurement, and distribution of family planning commodities across all levels of health facilities. Mission Parivar Vikas has been introduced for substantially increasing access to contraceptives and family planning services in 7 high-focus states having TFR of more than 3, namely Uttar Pradesh, Bihar, Madhya Pradesh, Rajasthan, Jharkhand, Chhattisgarh, and Assam. Lastly, scheme for home delivery of contraceptive by Ashas at doorstep of beneficiaries has been taken up. The last program under the first section is Lakshya program, which is Labor Room Quality Improvement Initiative, which was launched on 11th December 2017. It is a quality improvement initiative which aims to ensure quality of care during intrapartum and immediate postpartum period in labor room and maternity OT. It targets all government medical college hospitals, district hospitals, and equivalent health facilities designated FRUs as well as high caseload CHCs. Under the initiative, a multi-layered strategy has been framed, such as concrete steps for infrastructure advancement, ensuring availability of essential equipment, providing adequate human resources, capacity building for healthcare workers, and improving quality processes in labor room. Under the purview of Lakshya, one of the facility level targets is to achieve 5% or less surgical site infection rate in maternity OT, or at least a reduction of 30% from the baseline. Section National Nutritional Programs. National Iodine Deficiency Disorders Control Program. The disorders caused due to deficiency of nutritional iodine in the food or diet are called iodine deficiency disorders or IDDs. It is required at 100 to 150 micrograms daily for normal human growth and development. In 1962, the Government of India implemented the National Goiter Control Program, now called the National Iodine Deficiency Disorder Control Program or NIDDCP. The objectives are as follows: surveys to assess the magnitude of iodine deficiency disorders, supply of iodized salt in place of common salt, resurvey after every 5 years to assess the extent of iodine deficiency disorders and the impact of iodized salt, laboratory monitoring of iodized salt and urinary iodine excretion, and finally, health education and publicity. The next program I'll be covering is MA, or Mother's Absolute Affection Program for infant and young child feeding. MA is a nationwide program to bring undiluted focus on promotion of breastfeeding and provision of counseling services for supporting breastfeeding through health system. The program has been named MA to signify the support a lactating mother requires from family members and at health facilities to breastfeed successfully. The goal is to revitalize efforts towards promotion, protection, and support of breastfeeding practices through health systems to achieve higher breastfeeding rates. The objectives are as follows: to build an enabling environment for breastfeeding through awareness generation activities targeting pregnant and lactating mothers, family members, and society to promote optimal breastfeeding practices, reinforce lactation support services at public health facilities through trained healthcare providers and through skilled community workers, to incentivize and reorganize those health facilities that show high rates of breastfeeding along with processes in place for lactation management. The next program we'll be covering is National Program for Prevention and Control of Fluorosis. NPPCF was initiated in 2008-9 and is being expanded in a phased manner. The NPPCF aims to prevent and control fluorosis cases in the country. The objectives are as follows: to collect, assess, and use the baseline survey data for fluorosis of Ministry of Drinking Water and Sanitation for starting the project, comprehensive management of fluorosis in selected areas, capacity building for prevention, diagnosis, and management of fluorosis cases. The next program is National Iron Plus Initiative for Anemia Control. The Iron Plus initiative is an attempt to look at the iron deficiency anemia comprehensively across all life stages, including adolescents and women in reproductive age group who are not pregnant or lactating. This initiative will bring together existing programs like IFA supplementation for pregnant and lactating women and children in the age group of 6 to 60 months and introduce new age groups. It includes bi-weekly iron supplementation for preschool children of 6 months to 5 years, weekly supplementation for children from 1st to 5th grade in government and government-aided schools, weekly supplementation for out-of-school children of 5 to 10 years at Anganwadi centers, weekly supplementation for adolescents of 10 to 19 years, pregnant and lactating women, and weekly supplementation for women in reproductive age. The next section is programs for communicable diseases. The first program is Integrated Disease Surveillance Program. The objective is to strengthen or maintain decentralized laboratory-based IT-enabled disease surveillance system for epidemic-prone diseases to monitor disease trend and to detect and respond to outbreaks in early rising phase through trained rapid response team, also known as RRTs. The components are integration and decentralization of surveillance activities, human resource development, use of information communication technology, strengthening of public health laboratories, and intersectoral coordination. A total of 13 diseases, both communicable and non-communicable, have been included for surveillance as per the decision of the IDSP committee. The next program is Revised National Tuberculosis Program or RNTCP, which was launched in 1997 with implementation of Directly Observed Treatment short course strategy. The goal is to decrease the mortality and morbidity due to TB and cut down the chain of transmission of infection until TB cases to be a public health problem. NTEP objectives: early diagnosis of TB patients, prompt treatment with quality assured drugs and treatment regimens, to engage with the patients seeking care in private sector, prevention strategies including active case finding and contact tracing, airborne infection control, and multi-sectoral response for addressing social determinants. The next program is National Leprosy Eradication Program or NLEP. It was launched in 1954-55 and it was the National Leprosy Eradication Program which was introduced in 1983. The strategy was to control the disease through reduction in the quantum of infection in the population and reduction in infection source, thus breaking the chain of disease transmission. The objectives are as follows: to reduce prevalence rate less than 1 in 10,000 population at subnational and district level, to reduce grade 2 disability less than 1 among new cases at national level, to reduce grade 2 disability cases less than 1 case per million population at national level, 0 disabilities among new child cases, and 0 stigma and discrimination against person affected by leprosy. The key features are Leprosy Eradication Program is a centrally sponsored scheme of Government of India. It functions under the umbrella of NHM. NLEP follows decentralized health planning. Quality of services and sustainability are of focus. Disability prevention and medical rehabilitation is a priority, and removal of stigma and discrimination is a part of strategy. The next program is National Vector-Borne Disease Control Program or NVBDCP. It is an umbrella program for prevention and control of vector-borne diseases. 6 vector-borne diseases are covered under it, which are malaria, dengue, chikungunya, Japanese encephalitis, lymphatic filariasis, and Kala Azar. The strategies are as follows: focused intervention in high malaria endemic areas, linkage with National Rural Health Mission and use of NRHM institutions for prevention and control of VBDs, strengthening of human resources, introduction and scale up for rapid diagnostic kits, introduction and scale up for artemisinin based combination therapies, geographical information system mapping for focused intervention in high risk prioritized district, upscaling use of bed nets, preferably long-lasting insecticidal nets, intensive monitoring and supervision, intensified information, education and communication, and behavior change communication activities involving communities. The next program is National AIDS Control Program. NACP was implemented in India as a comprehensive HIV/AIDS prevention and control program. The NACP-1 began in 1992, intending to slow the spread of HIV infections to reduce morbidity, death rate, and impact of AIDS in the nation. NACP-2 was launched in November 1999 to reduce the spread of HIV infection in India and increase India's long-term capacity to respond to HIV/AIDS. NACP-3 was launched in 2007 to halt and reverse the epidemic over 5 years, and NACP-4 was launched in 2012 to accelerate the reversal process and strengthen the epidemic reaction in India over the next 5 years through a careful and well-defined accession process. Objectives of NACP-4 are as follows: reduce new infection by 50%, and providing comprehensive care and support to all persons living with HIV/AIDS and treatment services for all those who quit it. NACP-5 was the program launched for 2021 to 2026. The NACP Phase 5 aims to reduce annual new HIV infection and AIDS related mortalities by 80% by 2025 to 26 from the baseline value of 2010. The objectives of NACP-5 are as follows. First is the HIV/AIDS prevention and control. 95% of HIV positive know their status. 95% of those who know their status are on treatment, and 95% of those who are on treatment have suppressed viral load. 95% of pregnant and breastfeeding women living with HIV have suppressed viral load towards attainment of elimination of vertical transmission of HIV. Less than 10% of people living with HIV and key population experience stigma and discrimination. Next is STI or RTI prevention and control. Universal access to quality STIs or RTI services to at-risk and vulnerable populations, and attainment of elimination of vertical transmission of syphilis. The next program is Pulse Polio program. Pulse Polio is an immunization campaign established by the Government of India to eliminate poliomyelitis in India by vaccinating all children under the age of 5. National Immunization Days or NIDs are the Pulse Polio Immunization Program launched in India in 1995 and is conducted twice in early part of each year. Additionally, multiple rounds of subnational immunization days have been conducted over the year in high-risk states or areas. The next program we are covering is National Viral Hepatitis Control Program. NVHCP has been launched by Ministry of Health and Family Welfare, Government of India on the World Hepatitis Day, which is 28th July 2018. It is an integrated initiative for the prevention and control of viral hepatitis in India. The aim is to combat hepatitis and achieve countrywide elimination of hepatitis C by 2030, achieve significant reduction in the infected population, morbidity and mortality associated with hepatitis B and C via cirrhosis and hepatocellular carcinoma, reduce the risk, morbidity and mortality due to hepatitis A. The key objectives are to enhance community awareness, to provide early diagnosis, to develop standard diagnostic and treatment protocols, strengthen the existing infrastructure facilities, develop linkages with existing national programs, and develop a web-based viral hepatitis information and management system to maintain a registry of persons affected with viral hepatitis and its sequel. The next program is National Rabies Control Program. To address the issue of rabies in the country, National Rabies Control Program was approved during the 12th FYP by the Standing Finance Committee as a central sector scheme to be implemented under the umbrella of NHM. The objectives are training of healthcare professionals on appropriate annual bite management and rabies post-exposure prophylaxis, advocacy for states to adopt and implement the intradermal route of post-exposure prophylaxis for animal bite victims, strengthen human rabies surveillance system, strengthening of regional laboratories under NRCP, creating awareness in the community through advocacy and communication and social mobilization. The next program that we are covering is the National Program on Containment of Antimicrobial Resistance. To tackle the antimicrobial issue, Government of India launched a national program on AMR containment during the fifth 5-year plan, which is being coordinated by NCDC. The objectives are to establish a laboratory based AMR surveillance system in the country to generate quality data on antimicrobial resistance, to carry out surveillance of antimicrobial usage, to strengthen infection control practices, and to generate awareness among healthcare professionals and communities on antimicrobial resistance and rational use of antimicrobials. The final section is the programs for non-communicable diseases. The first program is National Tobacco Control Program. The National Tobacco Program was launched in 2007-8 under 11th 5-year plan. The objectives are public awareness or mass media campaigns for awareness, building and behavior change, mainstreaming the program component as a part of health delivery mechanism under the National Rural Health Mission framework, mainstreaming research and training on alternative crops and livelihood in collaboration with other nodal ministries, and monitoring and evaluation including surveillance, example Global Adult Tobacco Survey GATS India. Rose campaign and Yellow Line campaign are some of the IEC activities at state and district level. The next program we are covering is the National Program for Prevention and Control of Cancer, Diabetes, Cardiovascular Diseases and Strokes. Launched in 2010 with focus on strengthening infrastructure, human resource development, health promotion, early diagnosis, management and referral. Under NPC-DCS, the NCD cells are being established at national, state and district level for program management, and NCD clinics are being set up at district and CHC levels to provide services for early diagnosis, treatment and follow-up for common NCDs. Free diagnostics facilities and drugs for patients attending the NCD clinics. The modified strategies are as follows: health promotion, outreach camps, management of chronic non-communicable diseases, capacity building, providing support for diagnosis and cost-effective treatment at primary, secondary and tertiary levels of healthcare, and providing support for development of database of NCDs through a robust surveillance system and to monitor NCD morbidity, mortality and risk factors. The next program we'll be covering is the National Program for Control Treatment of Occupational Diseases. The occupational health was one of the components of National Health Policy in 1983 and 2002, which was launched in 1998-99. The categories of major occupational diseases are given below. Next is the National Program for Prevention and Control of Deafness, which is NPPCD. It was initiated on pilot basis in the year 2006-7. Its objectives are to prevent avoidable hearing loss on the account of disease or injury, early identification, diagnosis and treatment of ear problems responsible for hearing loss and deafness, to medically rehabilitate persons of all age groups suffering with deafness, to strengthen the existing intersectoral linkages for continuity of the rehabilitation program for persons and deafness, to develop institutional capacity for ear care services by providing support for equipment, material and training personnel. The components of the program are manpower, training and development, capacity building, service provision including rehabilitation, awareness generation through IEC activities, monitoring and evaluation. The next program we'll be covering is the National Mental Health Program, which was launched in 1982. The objectives are as follows: to ensure the availability and accessibility of minimum mental health care for all in the foreseeable future, to encourage the application of mental health knowledge in general health care, and to promote community participation in mental health service development, and to stimulate efforts towards self-help in the community. The district mental health program was launched under NMHP in the year 1996 based on Bellary model. The next program we'll be covering is the National Program for Control of Blindness and Visual Impairment. National Blindness Program was launched in the year 1976 as a 100% centrally sponsored scheme. It was renamed as National Program for Control of Blindness and Visual Impairment and is implemented all over the country uniformly with the goal of reducing the prevalence of avoidable blindness to 0.25% by the year 2025. To assess the program, the National Blindness and Visual Impairment Survey was carried out during 2015 to 19, which showed reduction in the prevalence of blindness from 1% in 2007 to 0.36% in 2019. The main causes of blindness are as follows. You can refer to the list given. The next program we'll be covering is Pradhan Mantri National Dialysis Program. The end-stage renal disease continues to be a result of existing and emerging burden of non-communicable diseases. Patients require long-term care that involves resource-intensive procedures like dialysis. It was launched in 2016-17, ensuring availability of dialysis services free of cost to below poverty line beneficiaries at the district hospital in the country. The National PNMDP portal was launched on 5th May 2022 and is operational across the state for registration of dialysis patient using Ayushman Bharat Health account, that is the ABHA ID. The next program we'll be covering is the National Program for Healthcare for Elderly, which was launched in 2010. The program is state-oriented and basic thrust of the program is to provide dedicated healthcare facilities to senior citizens at various levels of primary healthcare. The objectives are to provide accessible, affordable and high-quality, long-term, comprehensive and dedicated care services to an aging population, creating a new architecture for aging to build a framework to create an enabling environment for a society of all ages, to promote the concept of active and healthy aging, and convergence with National Rural Health Mission, Ayush and other line departments like Ministry of Social Justice and Empowerment. The next program we'll be covering is the National Program for Prevention and Management of Burn Injuries. The estimated annual burn incidence in India is approximately 6 to 7 million per year. The high incidence is attributed to illiteracy, poverty, and low-level safety consciousness in the population. The goal is to ensure prevention and capacity building for infrastructure and manpower at all levels of healthcare delivery system to reduce incidence, provide timely and adequate treatment to burn patients, to reduce mortality, complications, provide effective rehabilitations to the survivors. The objectives are to reduce incidence, mortality, morbidity, and disability due to burn injuries, to improve awareness among the general masses and vulnerable groups, especially women, children, industrial, and hazardous occupational workers, to establish adequate infrastructural facility and network for behavior change communication, burn management, and rehabilitation interventions, and to carry out research for assessing behavioral, social, and other determinants of burn injuries in our country. The next program is the National Oral Health Program. The Government of India has initiated a National Oral Health Program to provide integrated, comprehensive oral health care in the existing healthcare facilities. The objectives are to improve the determinants of oral health, to reduce morbidity from oral diseases, to integrate oral health promotion and prevention services with general healthcare system, to encourage promotion of public-private partnership model for achieving better oral health, dental unit equipped with necessary manpower, equipment including dental chair and support for consumables would be provided to the states through the NOHP. These units, according to the level of saturation of states' own dental units, may be established at district hospitals or in the health facilities below in the level of district hospitals. Now I have shared some additional information related to chronology of health missions and program. Please go through them. Thank you very much for your patience.